All right, so we are going to get started now. I hope you all are having a great rest of your day or great start to your day so far. But I am here with Dr. Lakowsky, and we will be doing an interview, which is very exciting. How are you doing today, Dr. Lakowsky?
I'm doing great, thank you. I'm trying to get my video started, but
Let me see if I can assist with that.
here we go.
Perfect. Well, nice to meet you.
You as well.
So I'll just do a little intro about myself, and then I'd love to hear an introduction about you, and then we can get right into the interview.
Sounds good.
So my name is Delaney. I'm an advisor here at AM Opportunities, and we provide clinical rotations in the US. I'll be going into a little bit of a presentation after we have the interview, but as I have shared, we're doing an interview with Dr. Lakowsky, and I'd love for you to introduce yourself to everyone.
Yeah, thank you for having me. I'm Dr. Alexander Lakowsky. I'm an internal medicine doctor in the San Francisco Bay Area, and I've been doing this for a while. I don't want to tell how many years, but it's been a few. And then as a part of being internal medicine, it gives us a fantastic opportunity to teach students, residents, or anyone else who wants to learn in the various modes of development. That's how we call them. And in my particular practice, we've been hosting American residents, international medical students, and doctors for many years. We practice evidence-based medicine. We teach to the content of USMLE steps 1 and 2, and we provide an introduction to those visitors who are not familiar with the U.S. mode of healthcare delivery to the U.S. mode of healthcare delivery. And we obviously serve as a one of the preceptor sites for AMO. And we enjoy teaching. We do this almost on a daily basis throughout the year. We take it as an opportunity to learn more ourselves. We always learn something new on a daily basis. Medicine is always like that, it's expanding. But as far as hosting for AMO, it's a wonderful experience for both us and visitors. I know that everyone has questions about letters recommendations and how to get into residence, and we go over all that whenever you rotate with us. That's just a simple plug for us, but I'm certain that every other site for AMO will do the same thing, and every other preceptor will do the same thing for you.
Thank you for sharing all that, and we do love working with you, of course. So I did actually bring up your rotation, and I'm going to share my screen if that works. So the first question is just for you to share a little bit more about your specific rotations. I know you have one that's in person and one virtual, correct?
Yes, currently, yes, that is correct.
So yeah, so any information you can provide, as well as like what they'll experience when having that rotation. I know you shared a little bit, but I'd love for them to have a visual so they can look it up.
Yeah, absolutely. So as I mentioned, this is the internal medicine clinic where we see patients age 18 and up. And on a daily basis, you are exposed to a wide variety of diagnoses, wide variety of diseases. And as we try to keep everyone healthy, we, as I mentioned earlier, do evidence-based medicine. That's what we practice. The current visitors, as Delaney mentioned, we have one virtual who follows me on the iPad, and the second person is here with me in person. They're currently at lunch right now, as I can do this, but they go in the rooms with me, they see patients with me, and they're able to see what we do. We try to teach to step 2 questions for the person who is in person right now because she hasn't taken it yet. And the very first day that she's been here, we went over like 16 various diagnoses and topics that pretty much covers the whole breadth of what steps cover, because that's what we see in real life. Yes, there's a patient with heart failure. Yes, there's a patient with cancer. There's going to be a patient with high blood pressure, with back pain, headache, COVID, pneumonia, sore throat, everything. You're going to see that daily. And the more exposure you get, the the better you'll be able to answer test questions and the better you're able to treat patients. And you, as a visitor, do it all here with us, which serves as a fantastic opportunity to see how we treat patients. And if you come from a different country, certain things might be a little different. Doesn't mean they're better, they're different. But you need to know that difference in order to succeed in passing or achieving a high score in your step 2 CK, and also, to get a letter of reference in order to get into residency.
Thank you for sharing all that. That was very
Right.
helpful for our viewers. And yeah, as you see, when you do go on the website, you'll be able to see all this information. So the schedule, as well as where it's actually located, and reviews. I highly recommend looking at reviews, as we know this program is very wonderful, but you are able to actually see that from the other trainees that have participated. So yeah, but thank you for sharing that.
Of course.
So as I said, I'll be starting with just some of my questions that I have prepared, but if anyone has questions here, I highly recommend asking Dr. Lakowsky. So my first question I have is if you could just share a little bit about the importance of virtual rotations or how that could be an option if someone cannot come to the US.
Yeah, so COVID gave us a great opportunity that we didn't, take advantage of before, and that's a virtual everything, not just the rotations, but virtual patient visits. We can talk to our relatives now virtually because we didn't do that before. As far as the rotation is concerned, you will get the same experience as if you're in person, simply because, as I just said, you will go in and see patients. You're still able to ask me questions. I'm able to tell you the treatment plan. I'm able to teach you about how we see patients and how we treat them. And as far as you're concerned, I would even argue that virtual rotation might be better than in person, only because you get to stay home. As I see patients in the office, while you're on the computer, you can quickly do an internet search. You can look up things that I'm talking about. If you're not familiar with something, it enhances your experience. You can't do that when we're in person. But while you on the computer, your phone, your tablet, doesn't matter, you're able to do a very interactive learning experience, a virtual experience. So in my opinion, there's no difference. I know your next question is going to be, how is it reflected in the letter of reference? It is not. We don't really specify, oh, so-and-so was here virtually in person. We just say, so-and-so completed a 4-week clinical rotation with me, and this is the type of person he or she is, and we speak to qualities. But whether we're here in person or virtually doesn't matter. Now, some people like to touch and feel things, and that's okay. And if that's you, then maybe it'll be better for you in person. But as far as what you're getting out of it, as far as your experience, your learning opportunity, and the letter of reference, there's absolutely no difference. And if you're able to do it from your home country, you have to allow for time difference. That could be one of the drawbacks, is that you may have to do it during wee hours of the morning or night, depending upon where you are in the world. And I've done this with students from Africa, from Ukraine before the war, from England. Actually, I had one last year, and they had to do it really early in the morning. But if you're able to do that, then virtual rotation might be just as good as the in-person one for you.
That is exactly what I was going to ask. So thank you for responding and answering so clearly on that. Honestly, it is a misconception that there is a very big difference and that the virtual isn't as good. But as I've had many conversations with physicians, as well as you, Dr. Lakowsky, there's no difference. So it's good to note that. And either way, we do want to be able to provide you with a clinical experience. So if you are interested in virtual, again, we'll discuss that later. So just stay tuned for that. My third question I have is, what can I do during the rotation to set myself apart from other candidates?
Yeah, that's excellent. So basically what you want to do is you want to show interest, and you want to show your involvement. Asking questions, very important. Giving your input in patient care is very important. And also, I typically ask my visitors to do a presentation on a topic of their choice as it relates to medicine. It's your choice, whatever you want to talk about. But once you present it to me, I can see what kind of physician you are, what your thought process is, and I can certainly put that in a letter of reference, which makes it a lot better. and makes you stand out a little bit more. But just be engaged, be involved. The worst thing you can do is say nothing. If you're doing a rotation, if you say nothing, if you don't ask any questions, then I don't know, why you're here. I don't know what kind of person you are. It's hard for me to, do more than the typical standard. He or she showed up, and that's it.
That is a great point. Thank you for sharing that. My fourth question is, and also, as I said, anyone who's here, please ask questions too. The question is, okay, this is interesting. Any thoughts on like the steps process, or if they should complete a step before the rotation?
Well, so right now, step one doesn't really matter because it's pass fail. So as long as you pass it, it doesn't really matter. From what I found, most of the international visitors are very smart and they're able to pass step two now. Step one. For step two is a little different because it's the only score you're gonna get. It puts so much more importance on getting a high score. Why do you need a high step two CK score? Because that's what programs directors use to separate you into two piles before they invite you for an interview. Whatever that score is depends on the program, but obviously the higher the better. So you need to be able to go over that threshold. Now, if you have never rotated in the US, or if you don't have a clear understanding of US healthcare delivery, it might be to your benefit to do a rotation before you take step two, simply because there's certain questions that are not medical. There's certain questions about the cost of care. There's certain questions about Medicare and how that works. Those are very simple questions, but this is not something that step two teaches you. It's being taught in US medical schools, but it's not being taught abroad. So it really has to do with the business side of medicine. And that you will learn when you're doing a rotation pretty much anywhere. So to that extent, I think it might be of benefit to do the rotation before you take step two, because I think that can increase your score by a few points. And sometimes getting over that threshold will make a difference between being invited for an interview or not.
That makes sense. The question after this kind of goes with what you just shared. It was, why should either early medical students, like first, second, third year, participate in these clinical rotations? And it seems, yes, for the steps to add.
Yeah, for medical students, a little different too, because for medical students, if they, again, international medical students have never seen how things work. If you see how things work, sometimes you can say, this is not for me. Sometimes you can say, oh, I don't want to do that. Well, that's very few. But for majority of medical students, it will be an eye-opening experience. So you learn so much more than you can just from reading things, because you'll see things, and that will enhance your clinical experience, and it will make your step one score, well, not score, but step one pass even easier to achieve.
Perfect. I just have a few more questions here. So the next one is why, and again, this is kind of broad, so any specific insight you have is appreciated. But why are the clinical rotations important for your letters, or for, applying to the residency match? Just any insight.
Well, the one main reason is that you can't really get into residency if you don't have a reference from a US based place. That's just how it is right now. If you don't have a letter of recommendation from a US clinical site, your application probably will not be considered. So it's just one of the requirements right now. So you have to have something, not so much to separate you from the rest of the pack, but to be invited to the den, so to speak. Which is why it's really important. And then again, it's important to understand that as an international graduate, you're not really competing with US medical students, because that's a whole separate pile. You're competing with the rest of international graduates. And there's a lot of applications, there's a lot of rejections, but there's also a lot of acceptances. And but every single international graduate who has been granted an interview and who matched or signed outside the match through SOAP, they all had one thing in common. They all have US clinical experience, which is why it's not just important, it's a requirement.
Thank you. Final question is, why do you think it's important for a trainee or a student or graduate to complete a rotation in a clinic or private practice,
As opposed to,
hospital.
oh, well, it's probably going to be very difficult to get a hospital rotation, again, simply because of how hospitals work and operate. Most U.S. hospitals, those teaching hospitals, have agreement with residency programs or local medical schools, so it's going to be very difficult to get a hospital experience. So let's say even if I'm a hospital-based provider, let's say I'm a surgeon and I'm in private practice, it's going to be very difficult for me to bring you into OR because you don't have any credentials. So it's logistically very hard. Private clinics, very easy. We make the rules. We allow you to see patients, and we can provide you with the experience. But in order to have a hospital rotation, you need to have an affiliation of some sort. And I know it's possible in certain states, but it's exceedingly difficult to get an outside person into hospital exam room or hospital procedure room if that person doesn't have proper credentials or proper authorization.
Thank you for answering that. So those were all the questions that I have. I do see, let's see, we do have one question if you have a moment for it.
Of course.
It says, okay, in terms of LORs from US-based experience, does it make a difference if the experience was done before or after graduation? So just
No,
like
yeah,
timeline.
so that does not make any difference because you'll have the experience before residency, before application to residency rather. So as long as you do it before, it doesn't matter when in your process. Now, maybe a follow-up question to that is, let's say you graduate your medical school in your country, and then you take 5 years off doing something else, and then you decide that you want to do residency, and then you do clinical rotation. You will need to explain that 5-year gap to the residency program, because they don't want to see a lot of gaps in your medical education and training. But as far as when you do the rotation, it doesn't really matter. Again, my plug is for you to do it as soon as you can, as soon as you're able to, but for your own personal situation, it could be done anytime.
Definitely. And we do actually have pre-med rotations all the way up from first year, sixth year, and then graduated. So any year that we do have a rotation for you. So I feel that those are the questions. We can wait. Wait, hold on. If you're looking. Actually, this is a great question, and then we can end on this one. So this person's looking specifically for family medicine, and they asked regarding research programs for that, which we haven't really touched on. So can you just share a bit of your insight on
Absolutely. Yeah.
research?
So this is a very loaded question, and thank you for asking it. It shows a lot of thinking, but the very short answer is no. That's a short answer. But I can expand upon that. So I was talking to a program director a couple of months ago. She was a combined medicine pediatric program director at one of the hospitals in New Jersey. And she was telling me about they got a lot of applicants last year, and some of them had research experience, and the research experience was so broad and so advanced that she was like, well, we don't have any research here in our program, so if you want to do research, you're going to be bored here. So they rejected them. They flat out rejected people with research, stating that if you want to do research, you may not want to do residency. So it comes with the caveat. If you're doing research because this is your life, this is something you want, this is your passion, if you've been doing it since you were 16 years old and you're very interested in a certain topic, by all means, no one's going to say, hey, don't do it. If you're doing it for the sheer purpose of getting a residency, it will not assist you. Volunteer opportunities, second part of the question, it's very good. It's good to volunteer, but it's not the same as a clinical experience. Because as a volunteer, you're really not going to get the same level of reference. It doesn't hold as much water as the one where you did actual clinical experience rotation. But the most important thing for your residency application is your Step 2 CK score and the letter of recommendations. And that's what program directors are looking at greatly. Research, it's good to have if this is your passion, and you need to explain that in your statement that research is all, that's what you're all about. but they can easily see that if you did it just for the purpose of getting into residency, will not assist you.
That is helpful to understand. I actually do have a follow-up question on that.
Yep.
In your opinion, having like one research rotation and then the rest in person, is that the same thing that you're talking about? Or you're saying if they're just going full research?
Well, when you say research rotation, when somebody's doing research, it's not so much a rotation, it's years of some sort of working in the lab or crunching numbers or doing something under auspice of academic institution. You usually work for an established physician or a PhD. So this is more than just a rotation. This is, like a year or two of work. Yeah, but I guess the question is it better to do clinical rotation versus research? They're different. It's just that sometimes people will take time and spend a year of doing research rather than working on the application for getting into residency. The practice shows it's not very effective.
Okay, thank you for clarifying that.
Sure.
I do see we have some more questions, but these are more geared towards AMO. If you have some time, we can just wait a little bit more for some questions, just because I want to be cognizant of your time. Let's see this one. Oh, let's see the second one. So yeah, just to clarify, with the internal medicine programs, we have over 70 specialties. So we have more than just internal medicine. That's Dr. Lakowsky's specific program, but we do have many more that I can go into in a few minutes. We can wait.
I can answer the first question.
Sure, yeah, of course.
I have knowledge of that. Basically, the question is that can a rotation be designated sub-I for some international medical school? Again, the short answer is probably no, because for it to be sub-I, first of all, sub-I will almost always require hospital rotation, but second of all, your center needs to be affiliated with your medical school. So if you can find a person in the United States or doctor who is affiliated with the medical school and who is in agreement saying that, yes, we're going to complete all the requirements for sub-Is, then yes, it could count, but I don't think it exists. So again, the short answer is no, it's not going to be a clinical sub-I.
That was helpful. Thank you for answering that.
Sure.
Someone kindly thanked us. So of course, glad you were here with us. Let's wait, just a few more, maybe like a minute or so. All of your responses have been super helpful, so really grateful that you're here to answer the questions.
Happy to be here.
Yeah, let's see. Yeah, basically the next step of this presentation is for me to chat a little bit more about AMO, and I can give a little presentation. So if we don't have any more questions, I can jump into that right now. And Dr. Lakowsky, we do really appreciate your time. I'm glad that you were able to join. You're free, to stay for the presentation, or if you need to go, of course, hop off.
Thank you so much. All right. Good luck, everyone.
Yeah. Have a wonderful rest of your day.
You too. Thank you. Bye-bye.
Bye. All right, everyone. So yeah, thank you so much for answering all the questions and asking some great ones. Like truly, Dr. Lakowsky, amazing person. And also we do really enjoy having, that partnership and collaboration with him. I will be jumping into a presentation just more about AMO and how we can help. So as I shared, Dr. Lakowsky, we work with him for one of the programs. It's an internal medicine program. I will be sharing my screen quickly, and I'll make this short just because I see, there's a few of you here, but this will be also sent to everyone that registered. So that's why I definitely want to give the time to present this information to you all. So again, we do provide US clinical rotations. We provide support throughout the whole process. If you are wanting, to be in person, we provide rotations like observerships as well as hands-on. And then again, we do have that virtual option. So just to jump back into this more, this would be a in-person rotation. As you can see, there's an observership also for nurse practitioners as well as physician assistants. So we do have rotations for everyone. And then this again will be the price, and all of our rotations are mostly 4 weeks long, 1 month. If you are wanting to do multiple rotations, definitely can do that. But we do help with these 1 month long rotations. you are able to apply directly on the website. If you haven't already created an account, I highly recommend doing so. With that, let's see. When you do scroll down, you are able to see the hospital affiliations, which are very important. And you can also see the expectations of what you'll be learning. So if you have something specific that you're wanting to experience, I highly recommend looking at the expectation section as well as the exposure type. So as we talked about clinics, this is the rotation that Dr. Lakowsky has, but we do also have hospitals. So just wanted to reiterate that. And then again, you are able to receive these letters of reference or letters of recommendation, which are truly crucial and vital and 100% necessary when applying to the US residency match. So you do need 3 to 4 different letters of recommendation from the physicians that you work with in your specialty that you have. AMO, we've been around for 10 years. We've honestly helped thousands and thousands of students like you. We work with mostly IMGs or international students. We do work with students in the US as well, but we're really proud of how far we've come and how many students and graduates that we've helped. So what's great is that we do have a lot of universities that we partnership with, as well as also many partners. So if you're wanting, again, to be in, have an affiliation with a hospital or academic affiliation, we can help you with that. And again, highly recommend creating an account if you all haven't already, just so you can view all of our rotations that we offer. So we do have many different rotations. Actually, we're even close to 300 now. As you can see, there are a lot in the main cities. So California, New York, and Miami. We're actually based in Chicago, so we do have a lot of rotations there. As Dr. Lakowsky shared, virtual rotations are very much needed and 100% okay. So if you do not want to come all the way to the US, you could participate in a virtual rotation. You're still able to receive a letter of recommendation there. I do want to answer the question real quick about just the different specialties that we offer. So when you go up here, you are able to filter the rotations to what you're interested in. And I like doing this little demo on the webinar just to show you how easy it is to find a rotation that you're looking for. So what I usually recommend is going to the medical specialties first, and that's because it can just narrow it down a bit for you. So for example, someone asked about surgery. You would go to this area and press general surgery. And as you can see, we have 14 different options for you. So it does narrow it down quite a bit. Another thing you could ask yourself is, where do you want to visit? So we do have rotations across the US. If location is not a deciding factor, another thing you can look into is, do you want clinic or hospital, as well as the different affiliations with that specific program. For example, we have this program. It's a general surgery and wound care at Serena Group in Pennsylvania. As you can see, it's $2,199. That's the full amount specifically for the rotation itself. So to clarify, that does not include accommodations or any travel. This is specifically for the rotation itself. We do help you find a place to stay if that is something that you're interested in. And we do provide support throughout the entire process. So again, my name is Delaney and I'm your advisor. If you do have any questions, I did put my email in the chat box. If you're wanting to have a one-on-one conversation with me, if you'd like me to help you find a rotation for you, if you have any concerns or thoughts, truly, we're there to help, and we can help you with just the entire process of finding the rotation. And then once you actually reserve a rotation, you are aligned with one of our AMO coaches, and then they can help you with the documentation process. We also provide visa support by providing an invitation letter and also the enrollment process to make sure that you're enrolled on time. They also even host an online orientation so that you feel very prepared and ready for your experience. As I shared, when you do scroll down, you're able to see the expectations. So you're able to see what you'll specifically be learning, as you see, fundamentals of wound care and more. And you're also able to see, in a sense, what the requirements are. We do help you with that whole process. So if there were any requirements, that's where I would come in to help you as your advisor, just to make the process very simple for you. Going back to the search function, as you can see, we have 330 rotations, which is a lot, but it's because you get to decide where you'd like to go, what you would like to see, if it's a hospital or a clinic, virtual or research. There are so many options, so we just want to make sure that the rotation perfectly aligns with your needs. I do want to share also, if anyone on this call wants me to send them a direct email after this call, you can send me a personal message on the chat with your email, or you can use my email and reach out to me. But just want to share again that I'm here to help in any way. So just a few options here. For example, if you're looking for the research programs, you could press this button. If you want to go to a residency site, you can press here. Also, just different, hospital programs. So if you want to go to a hospital, here are the options for you. And yes, the list goes on. So just want to share how easy it is. Again, if you already haven't created an account, it's super easy. You just go to amopportunities.org and you put in just a little bit of your information, like what kind of specialty you're interested in and your background, and then we can go from there. Let me know again if anyone has any other questions. I do know me and Dr. Lakowsky had answered a few, but again, to clarify, we have over 70 different specialties, so we definitely have surgical rotations for you and just many options. So just want to share a few more slides and information for you all. So again, this is how easy it is to create an account. You can look at all of our programs, which is amazing. And again, this is the advisor team. I'm on that team as well. And we can help with, just understanding your goals, making sure we find a program that aligns and more. This is the coaching team. So once you do reserve a rotation, you would be aligned with a personal one-on-one coach, and they'll be able to help you with everything. They'll be your number one point of contact throughout the rotation as well. So if you have any questions, and they can also make sure that you receive your letter of recommendation. So as I said, we've already kind of gone through some of the programs, but again, we have a lot of elective sites. We have, specific specialties like so. We have research programs and ACGME sites. So if you have any specific needs, I highly recommend, emailing me so we can schedule a call to talk a little bit more about what you're looking for. And then also just looking at the website. As Dr. Lakowsky shared, a letter of recommendation is truly vital. You need 3 to 4 letters of recommendation when applying to the U.S. residency match. And that experience needs to come from U.S. physicians. So say you're wanting to become a cardiologist, you want to become, in that specific specialty, we do recommend having multiple rotations in cardiology so that you can get those letters of recommendation from the doctors that you work with. As you can see, is number 3 in most important element for a U.S. residency application out of 44 categories. So very high up there. As you can see, we have many fun stories from past visitors, anywhere from, in-person rotations to virtual. So this person shared, I was able to demonstrate my theoretical knowledge, perform procedures under the doctor's guidance, and meet an amazing team. I learned so much from the doctor and his practice. What's important to note is in these experiences, you will also be networking and meeting so many amazing other physicians that are in your, specific either clinic or hospital that you're at. And also you'll be able to work with other students or graduates that are in your same place. So these connections are just extremely important if you are wanting to become a US doctor in the future, just starting those connections as early as you can. Philip shared, my experience was unforgettable. It's the best experience I've had with an attending physician. I learned a lot about medicine, but also about life. It was a blissful experience. So we just know that, the programs that are on our website, we work closely with those physicians. We make sure that they're, amazing programs. The physician loves to teach. They love, being in that setting of assisting students and graduates. And finally, Diego shared, I feel very thankful for this experience. I was able to make a difference in the lives of many while feeling at home with a great group of helping, kind, and sometimes funny medical professionals. So Diego did one of our virtual experiences. As you can see, he still had a very amazing experience, and he was able to receive a merit-based letter of recommendation too. So again, all the programs that we offer are perfect. You just have to find the one for you. So this is the end of the presentation. I do feel that I've covered definitely the main parts, of AMO and how we can help. Again, with Dr. Lakowsky's program, if you are interested in internal medicine specifically, that would be a great program for you. It's in California, which is a very beautiful place, and you'd be able to meet him in person. Again, I had sent my email to all of you, so if you have any questions on anything we covered, I highly recommend reaching out to me just so I can help in any way possible. I'll just stay on for about one more minute. Let me know if you all have any questions. Let's see, a minute or so. If you can send any questions to the chat. If not, we will be ending this presentation. I do know that this recording will be going to everyone who registered. So if there's information that you want to rehear, you can definitely listen to the presentation. And also, if you have any questions or want to talk, again, my email is delaney@amopportunities.org. You can also schedule a meeting with me once you see my email, as my meeting link is shared, and we can have a conversation. Let's see.